From WHAM Rochester, this is 13 WHAM News at 11.
Good evening. In the coming year, your medical information could be shared with all hospitals, doctors, offices, and labs in the area.
Now, that's not meant to scare you. It's meant to help you get the best care. As we hear from Sean Carroll tonight, a regional computerized network of patient information that's shared with all healthcare providers could save you time and perhaps your life.
Sharing personal medical information. It's not the type of thing most people would be comfortable with, but under the right conditions?
It doesn't frighten me whatsoever, the passing on of good information.
In case of emergency and your doctor is not available, that someone else would be there and have this information at their touch of their hands, you know, just by going into the computer or however they set it up.
That's just what a 9-county regional network of basic patient information intends to do.
From the patient's point of view, it's much more convenient. There's nothing more frustrating than going to another physician's office and having to start from scratch, filling out all the forms over again.
So what are some of the benefits to the system? Well, let's start here at a hospital. Imagine you're rushed to the emergency room, you're unconscious and in need of care. Immediately, doctors and nurses will know what medicines you're on, what medicines you're allergic to, and perhaps what long-term condition you have that brought you here in the first place.
In a life-threatening situation, it could be life-saving to have that information.
Mixing prescriptions or duplicating prescriptions?
The entire pharmacy history is available so that those kinds of problems can be avoided.
And it should cut down on faxing and mailing of lab results, x-rays, and insurance info, too.
I think that a few years from now, we will wonder, how was it that we ever survived in a paper medical care system?
Sharing of information is always good when it comes to health.
Now, sharing good information is the key. This isn't your entire medical history on the screen of every doctor's office in the region. A pilot run of this program will begin in a few months. By next year, you could see that expand throughout the 9 counties in our region.
I know I've enjoyed watching my doctor kind of adapt to this new computer world. Is there any concern that this information could fall into the wrong hands?
Well, it's an understandable concern, but there are plenty of safeguards in this network and lots of oversight so your information isn't leaked. That would be against the law, after all. Plus, you're not automatically enrolled. Your permission is needed, and you'll know the information that's provided to this network.
All right. Hey, thank you, Sean.